Hi everyone, this is Sean with the Western Mass team of the MassSupport Network, here with your COVID-19 update for Friday, October 9th, 2020. So, starting with looking at cases, worldwide we saw another 2.2 million cases in the last week, increase of about 1 million cases. We also, here in the US, saw about 330,000 new cases in the last week, which is an increase of about 30,000 new cases in that time. Here in Massachusetts, we saw just over 4,000 cases, which is the highest it's been in quite some time. I'd say probably around like late June or so. So in all of these areas, on all these scales, the virus is increasing. In terms of deaths, things are generally on the downswing in terms of deaths, but we don't know how much longer that's going to last for. As deaths are a trailing indicator, with this rise in caseloads, we should expect to see an increase in deaths in the near future. However, with some of the advances we've made, hopefully these won't get as low or won't get as high, even as the case counts continue to rise, but we should still see a relative increase in these, with about 40,000 new deaths in the last week, which is about where it's been. The US, we saw around 7,000 deaths in the last week. And here in Massachusetts, we had about 85. So let's look at some of this information graphically. So here are all our key metrics around the country. Testing is continuing to rise. There are some hiccups up and down there, but on the whole, we are staying high there. But as you can see, cases are rising. And we are back to where we were in the beginning of August when we were on our last downswing, but now on our way back up. And hospitalizations are also slowly but steadily increasing. As you can see, deaths are down, have kind of leveled off there. It's at the point where the graph is kind of wiggly enough you can't really see it from this scale, but they are still not as low as they were before the summer spike. All right, but importantly, a lot of states are still having their highest record week of single case counts. As you can see, we've charted this chart out every so often. This shows when each state has shown the most cases in a single week. And you can see, for example, the July spike there in the middle with where Florida and Texas hit those huge levels. But here we are still seeing a number of states, especially in the Midwest, hitting higher case counts than they ever have before. But also concerningly, we start to see some northeastern states as well there, which is an area that has been as we kind of consider ourselves a little out of the woods for some time, but now things are met there. It's also worth noting that some of these, like Wisconsin, North Dakota, South Dakota, have been hitting their highest record week for a couple of weeks now, and just keeps pushing back because they keep getting worse and worse there. Now, of course, every so often, a release of backlog cases will throw off this this chart here. For example, when you look at Massachusetts there, our highest week was not May 31st. That's just when we released a lot of probable case data. But for the most part, we can expect these do reflect when states are hitting their highest amount. And to look at this at a broader scale, here's the 7-day cases by region. And this is one of the first times, since the beginning really, that every region is seeing an uptick. since like early May, there's always been at least one area of the United States that's been on the downswing, but now every region is seeing an increase in cases. These are total cases, not cases by population, and obviously all these census-defined areas have wildly different populations, but it is worth noting that everything is going up. Even us in the Northeast, that is a pretty big spike relative to how our summer went. So we need to be increasingly cautious as the fall goes on. All right, so let's look at developments. Of course, the White House super spreading event continues to dominate the news, but there's not really a lot of new data coming out about that at the moment. So let's look at a couple of new things released about the virus lately. So first of all, teen super spreading, which I'm just going to say maybe don't Google that phrase. Is a possibility. We've long been talking about how children are impacted by the virus, how they contract it, how they spread it. And now there has been a case study, an incident where a 13-year-old who only had very mild symptoms, just nasal congestion, nothing else, infected 11 family members at an indoor maskless get-together. So it is possible for very young people, and 13 is technically a teenager, but it's very much on the younger end of that, to get the virus and spread it on to many others. And as we're increasingly seeing, super spreading events are really what is driving the pandemic. And this was a family get-together of about 20 people. They were indoors, 14 of them were staying in the same house. There weren't really masks there. Interestingly though, there were 6 other family members who came and participated in this event, but did not go inside, spent the entire time outside, and though they were maskless, none of them were infected. But so this shows a little bit more about super spreading. Remember, though, it's that indoor aerosol spread is really the key there, and that also people of any age can spread the virus in area. So also, antibodies are heavily in the news following the experimental Regeneron antibody cocktail the president received 1 week ago today. And Regeneron has filed for emergency use authorization for its antibody cocktail. Now, we don't have a lot of full data on that one. They say they can produce 300,000 doses in the next few months. Now, the president has said that he believes it's helped him a lot. Of course, one anecdotal case study there is not really enough to prove that it is effective. The president, of course, has gotten several other treatments in that time. And of course, just because it works for one person doesn't mean it'll work for another, and side effects can be different from person to person. But they are moving for their emergency use authorization. Similarly, Eli Lilly, the other company that is making antibodies, has applied for its own emergency use authorization for its single antibody injection, with plans to file for one for their antibody cocktail next month. The difference being that one of them uses just a single type of antibody, while the cocktail uses a mixture of at least 2 for hopefully a greater efficacy there. Eli Lilly has released a lot of its data, no serious side effects, and they do reduce viral load and also appear to reduce the amount of people requiring hospitalization. One of the key things with antibody treatments is you do not have to wait for people to get sick to give them. You can give them after exposure. You can give them in mild cases to hopefully prevent them from becoming serious ones. And you can give them from people on an outpatient level to help their recovery along. Eli Lilly says it can produce about 1 million doses by the end of the year of its single antibody and about 50,000 of its cocktail, assuming both of those are approved. Also, the final report on remdesivir came out with some mixed results there. Remdesivir is, of course, the one big new drug that is shown to be effective for the virus. Previously, it was believed with its initial study reports that it had capacity to reduce hospitalizations by about 4 days, shortening them from an average of 15 to about 11. So the good news is that the final report says that it actually reduces stays to 10 days, so 5 days instead of 4 on average, which is good. However, it has not shown a significant improvement in death rates. There may be a slight one, but there wasn't something they could really pin down and measure. So this is, again, kind of more of a moderate case use drug then. I mean, it's the only thing that's going to really reduce death rates at this point is dexamethasone, but remdesivir can reduce the course of an illness, and that is still important because reducing a hospital stay reduces the number of beds that are occupied and makes more room for more people, and that can help the strain on our medical system. However, one other interesting factor on this is that it was also shown, although they didn't have great data on distribution by race, but that remdesivir showed better effects in white people than people of color. And there's going to be some unpacking on that. There's initial data there, but we'll see what the underlying reason for that is. If it has something to do with when people are able to first get treatment, or something about underlying conditions in the population groups that they sampled, or something else there. But it's always kind of distressing to hear when a promising drug is not as promising for all groups of people. And you can find the stats and trends data from mass.gov, New York Times, and COVID Tracking Project. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.